may be there. I haven't looked yet, but once again, here's the URL. If you're looking at the Skype chat window. So assuming you're all going to be there in a couple of minutes, we're going to cover like a really, really lot of material. And once again, it looks like we're not going to have any audio-visual problems. I see Antoinette is not here. Chuck is not here. Dolores is here. Hi, Dolores. Say something or write something. You'll make me feel better. Isla has saved the day. I think she is hosting. Oh, no, Margaret is hosting. No, it looks like the crown is on Isla right now. So it looks like Isla's hosting. Jane is here. Jessica is here. Jim is here. Lois is not here, but she is not a student technically, but I still like it when she's here. Margaret is here. Rick is here. Wilhelmina was here, but it looks like she's gone again. So I think we're ready to rock and roll. What do you think? Do you think we're ready to rock and roll? We're going to be a little bit stressed out today, and maybe we'll really hustle a little bit or maybe take not too long of a break. But the one thing we cannot avoid doing today is, because we're going to be on the island pretty soon, is getting into a little island type atmosphere.
Wake up, Gassa. It's now rock already. The band coming down the road. You go get it super morning. You go check the line road. Early Tuesday morning, me bounce a little thing. She come out to play. She say that she a lady day just done in. She already setting. So hot man, so full of it. This girl taking she fit down by the guard at 4:30 sharp. Somebody in the crowd say her name loud.
Suzette.
Must have it on his head. Darling, you go tell your mother that Suzette. Daddy said don't wake a sweat. Darling, you go tell your daddy that.
That song won an award last year for being one of the best Caribbean songs at their annual carnival. And it was such a terrific song. You would see people playing it loud out of their cars and their heads would be bobbing up and down. I really, really like that song a lot. It's by Herb Black and it's called Suzette. And someday I'll actually be able to figure out what he's saying. Let's talk about heart diseases. This is the organization of what we'll be talking about today. Also the chapter. We'll be talking about a little bit about the normal features of the heart and especially how they might pertain to pathologic findings. The first topic is heart failure, which is the end result of any serious heart problem. Then the specific heart diseases, which are grouped into congenital, ischemic, hypertensive, valvular, primary muscle failure or cardiomyopathy, pericardial diseases, a few words about that, and last but not least, tumors. We're going to be going really fast. I may skip over a few things. Hopefully the stuff I skip over won't be the important stuff. I'm hearing an echo, so please mute your mics. And we are going to be going on a Kawasaki Ninja motorcycle. Normal features of the heart: pumps out about 6,000 liters per day as a cardiac output normally. Amazingly, the heart only weighs about 250 to 300 grams ideally. I don't think you will ever see a heart that small when you do autopsies of elderly people, because if they have not died suddenly and they're older, invariably they are in failure and the heart is enlarged, hypertrophied, dilated. It's very rare to see 250 to 300 gram hearts, even in a anatomy lab full of cadavers. Let's say it accounts for half of all deaths. And, we know the death rate has gone down drastically in the last 20 or 30 years. You also know, as a general rule, whatever the thickness is of a myocardial chamber, that's totally determined by the pressure that it has to sustain, especially the diastolic pressure, which it has to contain commonly. And the one number I'd like you to remember if you don't mind. I hate to throw numbers at you, but you have to remember that the thickness of the left ventricle is about 3 times bigger than that of the right. Why is that? Because the pressure is about 3 times bigger. That's why. Systemic pressure is always about 3 times bigger than pulmonary pressure. So remember this. The left ventricle is 1.5 centimeters normally. Have a little ruler around if you're ever in an autopsy or anatomy lab, and don't listen to any bull. If it's more than 1.5 centimeter, it's probably enlarged. The right ventricle is 1/3 as much, and the atria are about half of what the right ventricle is, and that directly corresponds to pressure requirements of systole and diastole. You both know what that means. The main thing to remember, if you don't want to be a physicist and just be somebody that's logical, is Starling's law of the heart, which basically says the heart will pump out as much blood as the venous return gives to it. That's like a really great way to remember that. So what does cardiomegaly mean? It means enlarged heart. What does dilatation means? It means that the chamber is bigger than it should be. And hypertrophy means that the muscle fibers are all bigger. They are not hyperplastic. They have not multiplied. Heart cells, heart fibers do not divide. But hypertrophy means every individual fiber has become bigger. Why? Because it has to be. The same way your biceps hypertrophy when you lift weights. It strictly in response to pressure or work requirements. Here's a heart here. You can see there's the thickness of the left ventricle. When we were residents, we used to go 1 centimeter below the mitral valve as your thickness because you can see there is some variation. But if you want to generally average this out, remember, normal thickness, left ventricle, 1.5 centimeters. Right ventricle, 1/3 as much. Atria, half as much as the right ventricle. Here we go. Histologically, if we do the review, we're going to see all we have in myocardium, which is the main functional part of the heart. The epicardium or pericardium, endocardium are just thin fibrous linings. The main work, 99.99% of the weight, is the myocardium, and it's the same as classical cardiac muscle histology. It's striated, but it's connected between each other by these little discs. It has the intercalated disc sometimes that you'll see if you look carefully, like maybe here and probably here. The endoplasmic reticulum is called the sarcolemma. It's called the sarcoplasmic reticulum. It's loaded with mitochondria because it needs all that oxygen. There's a lot of capillaries, extremely rich network of capillaries. Sometimes it looks like there's individual blood cells strewn about between the fibers. Those are capillaries. Occasionally you'll see fibroblasts. And of course, you know, if you do electron microscopy, you'll see those little dots inside of the black dots inside of the myocytes, which are glycogen. In addition, the one thing you'll never see are the cells which secrete the ANP, or the atrionatriuretic peptide, which you know is the hormone that the atria secrete by specialized myocytes, which are very difficult to identify. In fact, I've never seen one, to tell you the truth, which responds to diuretic type action in the presence of increased atrial volume and pressure. Last but not least, here are a couple of kind of specialized cells looking like very much like almost like nerve cells with myelin, and these are the conduction system of the heart. This is what you might find if you took a section through the SA node or the AV node or the bundle of His or one of the two bundles. And I'm not going to go over that because I know you've already learned that greatly in cardiac physiology. And of course, if you just remember, the left side of the heart supplies the anterior walls. The right side is mostly the posterior wall. And then you have circumflexes, and you all know the definition, the classical arteries, you know, the so-called triple artery with the left anterior descending, the circumflex, the right, which usually goes posterior, the factors of dominant and stuff like that. Strict. As a result, you know, sometimes you will see scans done, perfusion scans. This is not meant to be but as you know, the various walls of the left ventricular myocardium can be thought of as being an anterior wall. a posterior or inferior wall, a septal wall, which is the wall that faces the right ventricle, and of course then the wall opposite from that. So if you think of the heart as kind of a cone-shaped object in your chest where the apex is pointing inferior, lateral, and hold on, inferior, lateral, and left with respect to the body, you could then take that heart and reconstruct it and look at all of the nice walls and how they're perfusing with scans. Here we go now. We're proceeding nicely. Let's talk about the valves. Classically, the atrioventricular valve are the tricuspid and mitral, and the semilunars are pulmonic and aortic. And as you know, both the pulmonic and aortic have three cusps, but you would never want to call those a tricuspid valve, would you? The mitral valve has two cusps, so that the old name for that is bicuspid. Here we go. Common findings in aging. These are very, very common things you'll see at autopsy. Besides the fact that the chambers are dilated and enlarged, it's very rare to find an older person dying of a chronic disease that has a normal size heart. They're usually about twice as normal, 400 or 500 rather than 250 to 3. So the chambers are hypertrophied, frequently dilated. The coronary arteries and even the aorta is tortuous, which means squiggly because of weakening of the wall. Myocardium is increased in weight or hypertrophied. And of course, you can have a variety of deposits, either due to aging or due to atherosclerosis, especially with respect to the valves. The classical finding is something called brown atrophy. That's something that you see in all older hearts, and even to a smaller extent, sometimes in younger hearts. It's a deposit of a pigment called lipofucsin, or lipofucsin, if you will, on the ends of the nuclei of the myocardial fibers, and it's just a degenerative pigment. But like almost all of the intrinsic pigments of the body, it has the same general glittery, golden, refractile appearance like hemosiderin, bile, or melanin. It has that same golden appearance. Some more aging things in the aorta now. You'll see aorta is being talked about as being tortuous on a chest x-ray because of weakening of the wall. There's calcific deposits throughout them. And of course, because you would like to think and frequently have thought of atherosclerosis as being identical with aging, whether it is or not doesn't really matter, but inevitably everybody has it and older people have more. Here's brown atrophy. If you look, you can see the nuclei of the myocardial fiber nuclei. And if you do an EM or even look carefully at the tips of these areoles, you'll see these tiny little pigments. They're brown because they makes the heart look a little bit browner because that, hey, they have to give the same appearance as like a melanin or a hemosiderin. And on EM, here we go. They're kind of deposited right at the ends of the nuclei of these fibers. So if we thought of the blood vessels as having a straw analogy, let's think of the heart as being a pump, which is a straw with valve, isn't it? So what are functionally or physiologically speaking, there's a variety of different kinds of diseases we could think about if you think of a heart as a straw with valves that pumps. You could have failure of the muscle, which is called myopathy or cardiomyopathy. You could have obstruction to flow, which would be a valve problem, wouldn't it? You could have regurgitant flow, meaning the valves are floppy and they're shooting backwards. That's the definition of regurgitant. You could have an electrical system disorder because of problems with the conduction system, technically. And of course, just like with blood vessels, we could have problems with failure to contain the blood. In other words, wall integrity problems. The walls can rupture if they are damaged or softened. Now, I have somebody else calling me right now, but I don't know what to do. Hold on.
Okay.
Hello.
Hello.
I think maybe I should call everyone back. Jess is having a problem and Antoinette as well. Is that okay?
Okay.
All right, so let's wait till we get him back on, or should we just all hang up and then I'll call just including everyone?
But I'm on now if you were going to do it just for me. This is Antoinette.
Hi, Antoinette. No, Jessica,
Oh, Jessica is having a
she's
problem
having a
too.
problem that she can't mute her mic with, if when Isla tries to add her when she doesn't get dumped. And she's got
Okay.
kids home, so she really needs to mute her mic, so she won't be able to join.
So who's hosting? You or Ayla?
Isla is, so I think
Okay.
maybe I should try to host. All right, so why don't we just all hang up and then, right? And then
Okay.
Okay.
John will figure it out, right?
Okay. Okay.
Okay.